So today I want to explain to you how a medical induction can sometimes lead to an increase in your chances of having a vaginal tear. Now, by medical inductions, I mean there's several different ways that your doctor can help you to induce labor or kickstart your labor. There are a lot of reasons for this, and then there's different ways. So a couple of examples might be a Foley bulb inserted into your cervix, or Cervidil used to help ripen your cervix, or Pitocin, which is administered via IV to help contractions get started. Now, know that once you start with some type of medical intervention like that, there's a lot of things that happen. One of those things is that you're more likely to need more interventions. And so a couple of examples of these might be forceps or vacuum or an episiotomy. And so tying this whole conversation together, when we look at your chances once you've had a medical induction, your chances of needing more interventions such as an episiotomy, there's also been studies that show that having an episiotomy increases your risk of having a more significant vaginal tear during birth. Now, having said all of that, does this mean that if you have an induction, you're going to tear? Not necessarily, right? Because birth is unpredictable, and there are a lot of factors that are very unique to you, your pregnancy, and your birth. So that doesn't always mean it's the case. This is just something that I wanted you to understand why or how sometimes a medical induction can increase your risks. Also, another side note that I want to mention is that this is not to make a case against medical inductions, because I do know that they are incredibly important for a lot of women and can be life-saving for women and babies sometimes.